Hello, everyone. I'm Richard Conway, reporting for Room Now from ACR 2022, and I'm coming at you virtually from Dublin, Ireland. I'm here today to talk to you about an oral presentation on Monday. This was by Namrata Singh and colleagues. This was abstract number 2218. And this was on frailty is associated with serious infections in biologic and DMARD treated ORA patients. And the first thing we probably should explain in talking about this is what is frailty. And we all have a kind of a concept in our own heads, I suppose, of what a frail patient is. Probably the best way to conceptualize it is an individual's ability to recover from unexpected stressors of any sort. So a frail individual is less able to recover from these. And a colleague of mine, Sebastian Satoy, recently used the term bouncebackability for this, which I think is a really good way of describing frailty. So a frail individual has less bounce-back ability than a non-frail individual. So what Dr. Singh and colleagues did here, they used a market scan database. They had 62,246 ORA patients treated with biologic or DMARD. They found that frail patients had a higher risk of serious infections with an adjusted hazard ratio of 2.37. They then adjusted that adjusted hazard ratio further for comorbidity burden and healthcare utilization, and it decreased to 1.34 but remained significant. Frail individuals also had an increased risk of all infections with an adjusted hazard ratio of 1.18 and an increased risk of all-cause hospitalization with an adjusted hazard ratio of 1.34. So overall, I think what these results are saying to us, it's not that we shouldn't be using these drugs in these frail individuals. In fact, maybe we should, and they'd be better than the alternatives of steroids, as we have discussed extensively previously. But it gives us something to watch out for. If we have a frail individual, we need to be aware of these potential risks and perhaps monitor them more closely. And overall, I think this is really adding to the information on frailty and rheumatic diseases and how important it is as a prognostic marker in our patient cohorts. So remember, check out Room Now for all the updates from ACR 2022, and you can follow me on Twitter at Richard P.A. Conway.